IUI or talk to you about that option if you are having a hard time getting pregnant. If they have, I think that people often have questions about like, what is it? What does it mean? How much is this going to improve my chances of getting pregnant? And more importantly, what can I do to get better outcomes with IUI? Okay, and I think that is a really important question, and let's break it down. I'm Katie, I'm a nurse practitioner, and I'm a fertility consultant, and I help people get pregnant faster. So if you have any questions or comments, drop them below, and if you feel like there is anything that we left out or anything that you want to dive into deeper, drop it below, and we can have another vlog. Okay, so one common mistake that I see regarding IUI is that couples think that it may guarantee pregnancy, okay? And it doesn't. It is a really great tool in the right patient, but you need to be a good candidate. And it can be a great first step before considering IVF for some people, but not for everybody, okay? So let's dive into first, what is IUI? IUI stands for Intrauterine Insemination. And what that does is it's a medical procedure that helps the sperm from having to go such a great distance. So normally sperm has to go vagina, through the cervix, to the uterus, then to the fallopian tube.
Wow.
And so what the fertility clinic will do, what your REI provider will do, will place the sperm that is concentrated into the uterus directly around the time of ovulation. So this gives the sperm a shorter distance to travel and just kind of sets the environment to be better and more conducive to that, and allows for kind of less things that have to like line up perfectly, right? Things that it does not do: it does not fertilize the egg. Fertilization still happens naturally within the fallopian tube, just like a normal pregnancy, okay, or a normal conception, I guess is better. Okay, so who is a good candidate? Not everybody is a good candidate, and this is a huge mistake that I see, that people are like, oh, cool, let's just try IUI. But I think that we really need to slow it down and really understand who's a good candidate and who is not, okay? So who is a good candidate? Mild male factor infertility. So if we see a slightly lower sperm count, mild motility issues, that we aren't seeing improvement after 3 months of kind of changing lifestyle, behavior, supplementing appropriately, then that starts being an appropriate choice for IUI. Certain ovulation disorders can also be good candidates. So those people that have PCOS, those people who have irregular ovulation, can be good candidates for this, especially with Clomid and Letrozole, which are medications that help kind of improve ovulation or help you ovulate if you're not ovulating on your own. Sometimes unexplained fertility, I think, can be appropriate, but I hate the word unexplained infertility because that means it has not been worked out properly. If we are running into like, we're not finding anything, except maybe some like, labs that need to be kind of tuned in a little bit, everything else is totally normal, this might be something that I would discuss with my clients, but I really feel like they need to have a thorough evaluation before doing this and spending time, money, emotional ups and downs. There's some things that I would really recommend that people go through first before just jumping to IUI. So another candidate is people who are getting a donor sperm. So those people who, I've had several different cases where people ended up either having children single, or they were afraid about like genetic issues with their partner that they did not want to pass down. And so that was like an appropriate reason for a sperm donor. I've had couples who are lesbian. They have been great candidates for this. It works very well.
Wow.
If again, mom has been kind of checked out, understanding what's going on, I think that can be a great candidate. Sometimes cervical factor infertility. If cervical mucus is challenging and sperm is having a difficult time getting there, that can be an appropriate candidate. Those people who are not good candidates are people with blocked tubes. Okay, that is going to be a waste of money and a waste of time. If we have severe male factor infertility, that sperm is just like really not able to get where it needs, that is going to be not a good candidate. And those people with significant ovarian diminished reserve, depending on age, overall picture, kind of like what's going on with your body. And so I think that for my older clients, It's a more calculated and a more, like we might set a timeline, like we're going to try this many times. And then if that doesn't happen, then we'll move forward with IVF. But again, it needs to be worked up properly to make sure tubes are patent. We need to really understand kind of like what is going on. And then, so when time is limited, because I am working with an older client, then that is something that, would be something else to kind of think about. And again, have a conversation about, because it can be a really great procedure. We just need to know that you're a good candidate, and also understanding kind of your chances of getting pregnant before you invest your time, money, emotional bandwidth. I think that's important. Okay. So what happens with IUI? So let's walk through the timeline. Step 1, cycle monitoring, understanding like your cycle, when is going to be the best for timing. And that's going to be done with labs and ultrasounds to really kind of look at follicle development, etc. Then number 2, sometimes, I would say most of the time for my clients, I've seen that some sort of ovulation medication is used, whether it's Clomid, Letrozole, gonadotropins that are like injections. Sometimes these can help promote maturing of the follicles prior to the process. And so usually I'll advocate for my clients to be on one of those medications to just bump things up and like bump up those chances. There's also an increased chance of twins when we do Clomid or Letrozole. It's a slight bump up, but it's there. Okay. Rarely, but sometimes I'll do a trigger shot to really kind of time ovulation, especially for somebody who is not having regular cycles. So that's kind of the pre-planning. And then we get the sperm collection, and then they do what's called sperm washing so that your body kind of will take it. When we put things directly into the uterus, it has to be kind of in a different form. Otherwise, it can be really uncomfortable. And then let's see. So yeah, when they are doing the sperm washing, they are taking out the seminal fluid. They are taking out any debris. They are taking out the poor quality sperm, looking at that, trashing the bad ones, and then they inject. That's the wrong word. Then they take a little catheter. So this kind of goes into the procedure. They take a catheter that has, that goes through the cervix, and it dumps that little sperm collection straight to the uterus. So most of them will say it kind of feels like a pap smear. It usually just takes a few minutes. Short, easy. You don't have to do anything really special afterwards. Now you just wait, which is always the horrible part, the 2-week wait. Okay. This is the hard emotional part. This is where you're Googling, like, what are the symptoms of pregnancy? Can I feel implantation? Was this implantation bleeding? Unfortunately, IUI does not remove that stressful part away from all of this. Okay. So the success rates are going to be different based on age, diagnosis, what is the reason that we're doing IUI. It's going to be impacted by egg quality, sperm quality, tubal patency, which is why you want to make sure your tubes are open before you do this. Usually there's going to be some sort of assessment of overall follicles, and your clinic will follow protocol on what they want to do. So general estimates per cycle are, again, going to be a little bit greater than if you were trying to get pregnant naturally each month. So those people under 35, we're going to have about a 10 to 20% chance of IUI working. 35 to 37, 10 to 15, 38 to 40, 5 to 10. And those who are over 40 are going to be lower. But again, there are some people who are over 40 who are good candidates. So I don't always just like say you're 40, you are going to need IVF, because that's just not true. So sometimes people do several cycles, and this is something we discuss. And they will say, like, if you haven't been successful, with this, then it may be time to think about IVF. And that's just a conversation to have. How to improve your chances of being successful with IUI. Basically, this kind of falls back onto optimizing egg and sperm quality. And that's what my course dives into. That's a lot about what I preach about. This is really understanding how to not only add to your body and give your body what it needs to really ensure that you can grow and develop these good follicles, but also means taking out certain things that are harming egg quality. And that may be something in your environment, that may be something in your diet, that may be something in your supplement routine, that may be something in your physical routine, that maybe negatively impacting the quality of sperm and eggs, etc. So really honing in on getting excellent nutrition, avoiding toxins, avoiding, again, these things that pull away from your fertility are important. Making sure micronutrients are topped off, making sure that we are kind of priming everything. CoQ10 is something that I really like, and I like my clients to be on it for 3 months before doing any sort of treatment, because that's how long it takes to kind of really change the lifespan of your eggs and sperm. Okay. Same thing with sperm quality. So avoiding smoking, heated areas, things like heated car seats, things like hot areas. It just kind of like melts the sperm. They just like don't work good anymore. So avoiding like heat exposure, using supplements based on semen analysis and any sort of other underlying medical issues. We want to tighten those up as much as possible. So if you've got rip-roaring diabetes, we need to get that under control. We're going to see that you have better results if glucose, insulin is all that is better controlled. And then what we do is kind of continue to monitor for ovulation and looking for timing to really understand how to time your cycle. That's important too, because we really want to kind of hone in on that fertile window for this. Another thing that's important is reducing inflammation. So whether that means losing a little bit of weight or gaining a little bit of weight, balancing blood glucose, exercise, movement, sleep, management of chronic inflammatory issues, doing an assessment for that I think is also important before spending time, money, and emotional energy on one of these treatments. Let's see. And then we also want to kind of like get your thyroid controlled. We want to make sure PCOS is controlled. We want to make sure insulin resistance is controlled. We want to make sure that inflammation related to endometriosis is controlled. But those people with endometriosis are often not good candidates for IUI just because they are more likely to have anatomical issues and inflammation issues. And that is the reason that they're not getting pregnant. And so those people with endo, IUI is not always my favorite choice. So if we do that, we really want to hone in and kind of make sure that you are a good candidate, understand kind of inflammation and endo levels before we move forward with IUI. Vitamin deficiencies, we want to repair those, make those right. So again, the kind of big takeaway here is that IUI is not about just like placing the sperm in the uterus. It's also about kind of equaling the fertility equation as much as possible before going through that procedure. So some common myths. IUI is just the same thing as IVF. No, it's not. It's completely different. Okay. IUI always requires fertility medications. Not necessarily. A lot of times I'll recommend that as an option. But some people just aren't good candidates or don't need that right away. Let's see. If sperm is placed in the uterus, pregnancy is guaranteed. Not true. There are a lot of other things that have to happen. We have to have good genetics. We have to have good egg and sperm quality for that to be able to happen. Myth number 4, if I failed IUI once, I will fail again. Not necessarily. Some people fail every round. Some people fail the first round and get pregnant on the second or the third or the fourth. So again, you just want to be having honest conversations and with your partner and with your provider about like what your plan is. Success can vary from cycle to cycle. And your successes or your percentage is about the same each month, right? So it kind of resets. It's not like, oh, if I do it 10 times, I'm going to hit 100%. Unfortunately, that's not how it works. So it can make sense for some people, not for everybody. It's not always a great solution for everyone. Questions for your fertility doctor. Why do you think I'm a good candidate, or am I a good candidate? What is my diagnosis? Why am I having to do this? Should we do natural cycle versus medication based on history, based on why you're needing IUI to begin with? How many follicles are we hoping to see? What are my success rates based on my history, medical history, and my age? And how many IUI rounds would you recommend that we do before I do IVF? Or if IVF is not in the plan for you, how many can we do, kind of thing. And then are there any other health issues that I should be working on optimizing before my cycle? So yeah, that's kind of the big overview. So IUI is when the sperm is washed and placed directly into the uterus with a catheter. You don't have to be put to sleep for this. It's an in and out procedure. It does not take too long. It works best for certain demographics of patients, and it is not It's not for everybody. Success is going to depend on your age, your diagnosis, the reason that you're needing IUI in the first place, egg quality, sperm quality, perfect timing, all that. And you really want to kind of make sure that hormones, nutrition, inflammation, all of this stuff is as controlled as possible and as tight as possible to really improve your chances of getting pregnant with the treatment. And then if you're not successful, that's when it's time to start looking at other options or kind of really kind of hone in on what your goals are. So let's see. Yeah, I think that's kind of wraps everything up. So if you have questions, drop them below. If there's other topics you'd like to dive into, let me know. And we'll see you on the next one.